Thank you, everybody. My name is Danny George. I work at Penn State College of Medicine, and I teach in our Department of Humanities, which is probably as baffling to you all as soil biology is to me and has been today. But I've very much enjoyed soaking everything in today and being a passenger on the microbiome cruise ship, to use the metaphor from last session. What I want to talk about today involves some of the work that I've done sort of as a side passion within our College of Medicine. And that's really to explore how hospital systems can better support local sustainable agriculture and healthy soil in the service of community and population health. And I think hospitals can do this by leveraging their buying power, by using their physical space to actually cultivate healthy foods, by drawing upon the rich resource of health researchers that we have at teaching hospitals, and so on. But ironically, hospitals are often some of the most unhealthy places, and I'll go on to explain what I mean by that. But let me just first invoke a very rare and obscure provision within the Affordable Care Act that has sort of changed the landscape for the kind of work that hospitals can do. So within the legislation, IRS Code 501R now requires that all hospitals have to do community health needs assessments every 3 years. But even beyond that, they now have to form implementation plans to show that they're addressing those community health needs. And so you can imagine in the communities that you all live in what these hospitals are going to find. They're going to find a lot of nutrition-related illnesses, a lot of chronic disease, diabetes, hypertension, obesity, et cetera. And hospitals, at least nonprofit hospitals, in order to keep their tax-exempt status and avoid a $60,000 excise tax from the IRS, they actually have to show evidence that they are addressing some of these community health needs. So that has really given us, people like myself who care about population health within health systems, a sort of leverage to get some programs started. And we've seen in the last decade a sort of burgeoning of hospital-based programs and infrastructure, things like farmers markets that are supported by medical centers. We've done research, we've counted about 92 of these markets that are affiliated with hospitals. There have been community gardens, 110 at our last count, that are affiliated or located on site at hospitals. We've even found that there are about 18 organic farms at U.S. hospitals right now. And these pictures that you see here are of our farmers market in Hershey on the top, which I have helped establish and direct for the past 8 years. Then our community garden, we have 225 plots located right on our hospital campus. This used to be a construction staging area. And so I'm now terrified of all the contaminants and pollutants and regurgitating nematodes that are floating around there. It's the stuff of nightmares, people. Why do you guys study this stuff? I can't imagine. But I have some good leads on people to talk to about making sure our soil is clean. But we have some really interesting programs there. We have young cancer survivors who we've paired with local master gardeners who are teaching them how to cultivate their own healthy produce. The Eating Disorders Clinic has a plot where their occupational therapist uses in patient care. We have a food as medicine plot where my medical students grow foods that are donated to low-income, food-insecure populations in the area. We also grow medicinal plants and are growing leafy green vegetables which have isocyanates in them, which are used for anti-melanoma research. So anyway, that's a long way of saying that these are very dynamic spaces on hospital campuses involving soil. And then we're currently in talks right now with our upper administration to flip a 10-acre parcel of land that's being conventionally farmed right now, leased to a conventional farmer, and turn that into a 10-acre organic farm that would be managed by the Rodale Institute, who many in the room may know, which is located just about an hour away from us in Hershey. So Dan mentioned the massive problem of lead poisoning in the country, and we all know about Flint. I do want to allude to one really innovative program that's been happening in Flint, though. You may have heard of Mona Hanna-Attisha. She's the pediatrician who helped discover the elevated lead levels in Flint's children. Her clinic is located in downtown Flint, connected to the central farmers market there. So we're seeing these sorts of mergers, again, as a result of the Affordable Care Act, of clinics literally co-locating themselves with farmers markets. As Dr. Basta and Dr. Lee said before, to have children who are affected by lead poisoning eat a better diet with fruits and vegetables can help decrease the absorption of lead and reduce oxidative stress and whatnot. So that's a very encouraging partnership. In Hershey, we've also implemented prescription produce programs. This is a model whereby doctors who work with low-income, at-risk patients can literally write a script for fruits and vegetables that the patients can take to farmers markets and redeem them for fruits and vegetables. On the bottom here, you can see one of my medical students working with a woman who was referred into the program. The students actually meet the patients at the farmers market over the course of 4 visits and help them learn how to prepare healthy foods and learn about the social barriers in their own lives to eating healthy. And again, I now want to evaluate all of the microbiome of the vegetables that appear in farmers markets that we're giving to these folks, but that's for another day. So what needs to be done? I still think that we can develop and disseminate best practices with these sorts of innovative partnerships that lead all the way downstream to soil health and the microbiome. And I think in as much as we can show clinical benefits downstream to actual human health and cost effectiveness, that will encourage replication. So just to show you a few more pictures here, these are three other medical students of mine who are in the food as medicine plot, and they are harvesting just under 100 heads of lettuce that the Rodale Institute donated to us, and we in turn donated them to a dozen Syrian refugee families that are living in the Harrisburg area that we work with. And so we're just finding different ways to use the soil, the literal soil of the hospital to reach low-income populations. And there's also an economic story here. We haven't done this research, but we would love to show that this type of model is economically feasible for small producers. For instance, we just got a $10,000 grant for the medical students to take the Syrian families to the Broad Street Market in inner city Harrisburg every Friday. We've been doing that for the past 2 years, and we just got the grant renewed. And so basically that's money that is all going to local small-scale producers who are growing organically. So coming up with these partnerships is a good way of sort of leveraging the hospital's strengths with local agriculture to ultimately benefit populations. In terms of clinical outcomes, tracking chronic disease over time for people who are involved in these programs, and obviously today has really seeded me with some great ideas for how we can establish human benefit through biomarkers, things like looking at the microbiome. For instance, the program with young cancer survivors, chemotherapy just ravages the microbiome, and so it would be really useful to partner with people, the experts in this room, for instance, to look at how a microbiome is affected by something like community gardening for young cancer survivors. And furthermore, this is a more subtle message, but I see a real professional development improvement in my medical students. You see a sort of deepening of their professional ethic and their knowledge of public health, and really, the more that we can get healthcare trainees like my medical students and nursing students, PA students, et cetera, involved in this kind of work, they will leave their training knowing that soil is a key variable in population health. So we really need to try to get students in the health professions more involved. I've already addressed a lot of these issues, and I think there's a real need for greater partnerships between us and the people in this room. And I will just say in closing that we just submitted a USDA AFRI grant, which I think stands for Agriculture and Food Research Initiative grant. It was my first experience with a USDA grant, but that's to fund our organic farm. And just in the interest of a self-fulfilling prophecy, I'm going to show you our actual plan for the organic farm. So this is the 10-acre parcel of land, and the little building so just to the right of the farm is actually a children's daycare center. So I drive or walk by this area, and I see this farmer hitting this area with pesticides right next to a children's daycare center and within about 500 yards of our children's hospital, and it just makes me sick. So if I can have everybody's good feelings and good wishes, we're going to turn that parcel of land into organically farmed territory. So thank you very much.